Hey everyone, this is Dr. J with Dental Masters, and today I want to talk about how to manage your emotions and your anxiety as it pertains to getting a dental implant or an extraction dental implant before you even start the situation. The best way to manage comfort after the procedure. And the reason this is really not only important to me, but for me, is because dentists need dentists. I just went through this process myself. I had 2 teeth taken out, bone graft, implant placed. So I kind of want to walk you through that as a dentist and also what my experience was like. Okay, so here we go. There's 5 main things that I want you to consider before moving forward with the dental implant, an extraction dental implant, and here they are. So number 1 is managing emotions and managing anxiety that come with having a dental implant, dental extraction, dental bone graft. So this is something that starts really the moment that you know that you need this process. As that happens, the important things that you need to have are trust with the team that you're going to work with and the doctor, and really information about what's going to happen during the process. So if you have these 2 things, it's going to really help you get through that process with little anxiety and really help you manage that emotional component. And knowing the process, getting that information from the team, I can't emphasize how important it is that you trust the doctor you're working with and build that relationship. And this is something that's not distant for myself. So as I mentioned, I had to go through this process. I didn't think I could go through dental extraction implant without IV sedation, and in fact I did. I ended up using noise reduction headphones, the ones that you use on a plane, and I really trusted the doctor who was my friend from dental school, also who I was out in Seattle to help teach his course. And those 2 things, knowing his team, knowing the doctor, and also them giving me the information as I do them every single day. But I needed that level of trust and that information of how his process was going to work to really get through it comfortably, and I really did. I went great. Okay, let's get into part number 2, and that is going to be medications. So there's medications that can be used to manage anxiety before the procedure. That may be given a pill an hour before you come in. By the way, you need a driver if you need to use that route. There's IV sedation, and there's general anesthesia. These are all options that are available, not maybe at every practice, but at our practice, we offer all those options. And there's no shame in if you need to have general anesthesia, if your anxiety level is that high. Everyone deals with it differently. So that's the medication on the anxiety part on the front end, and making sure that you know what's best for you, having that conversation with the doctor and the team. Now, there's medications for after and how you manage the discomfort after. There's a lot of ways to do this. If you are being put to sleep or you're having IV sedation, we often will put really strong anti-inflammatories and medications in your IV that will help you as you wake up and you're still numb. The pain medication is starting to work, and that's key, is that when the numbing is wearing off, the pain medication is already in your system, so there's not really a transition. So that pain medication is important. Now, if you're not doing IV sedation and you just only have the ability to take a pill, one of the things that we do is we will give 600 milligrams of ibuprofen or Advil and 2 extra strength Tylenol right before we start. And by doing that, it does the same thing, is when the local anesthetic or the numbing is wearing off, the pain medication is already taking effect, and typically you can get through this process with Advil or ibuprofen and Tylenol, that combination, without having to use an opioid or a narcotic, which we try to avoid. Again, from my experience, I didn't have access to IV medications, so I sat down with Dr. Coyce. He gave me 600 milligrams of ibuprofen and 2 Tylenol. So I took those 3 pills, and he gave me the regimen to take after, and I really never had pain. It was amazing. I went back that day to teaching the course. That was a Thursday, so I went back Thursday afternoon, went through teaching our clinical exercise with the students. Follow the proper medication protocol. You'll get through it on the anxiety part and on the post-op pain part. So that leads me into point number 3, which is follow instructions. Seems pretty simple, but it's really important, and instructions may be different on wherever you go. So when you come to our office, we're going to give you a written set of instructions, and we're going to go over it with you. So you'll have it in writing. We'll read through it with you. And if you're going through a sedation, whoever's going to be your responsible companion or family member that's driving you to and from, and that's going to be responsible for you after the sedation, we're going to go over that instruction with them as well, because I can't emphasize how important these instructions are, whether it's medication medications like we talked about, what to do after. So again, from my experience, some of the most important pieces was follow the medication regimen, how to clean after, and icing. Believe it or not, simple icing. I was given an ice pack right out of the chair, and that's something that we do. And you're gonna ice basically for 20 minutes every 2 hours. You can do that up for the first 24 hours. And by doing that, it drastically reduces your swelling, your discomfort. And again, that was a huge piece of how I was comfortable after, and how you'll be comfortable if you follow the instructions that are given to you. Whether it's a gel you have to rub on your gums, whatever it may be, follow those instructions. All right, so number 4 is the elephant in the room, and you don't know it until you know it. So this is part of following instructions as well. So if you're getting a single implant or a bone graft extraction on one side of your mouth, following eating habits or instructions is important. So what's that mean? Well, the first 24 hours, you're gonna wanna have soft foods, maybe soup, eggs, applesauce, those types of things that are soft, easy to get down, protein shakes, smoothies, but cold things that you can get in your system easily. And part of that is because cold is gonna help the site. And the other part is you don't really want to do any real moving or heavy chewing. And the third part is you may still be numb. So you don't wanna have something that you're chewing on and bite your cheek or your tongue, because that's gonna lead to a lot more pain and a whole nother problem. So if you're somebody that's getting what we call one-shot smile in our office, or you may have heard teeth in a day, where the entire row of teeth, that's a whole different set of eating instructions that I can get into more depth. But basically it's a soft diet for about 2 to 4 months actually. And that means if you can squeeze it between your fingers, or you can cut it with a plastic fork, you can eat it. Again, that's a whole different process. I want to speak more today about the one side. So what happens after that? So you get through your first 24 hours and you're not having a lot of pain. You really have to try to eat on the other side and try to avoid really any sharp foods like chips or nuts that can get caught around those sites. I'm gonna tell you, I went through this. This has probably been the most annoying part for me. I'm getting through it, but it is difficult. You have to really focus on it. And so maybe plan your meals out. That's something that I've done, is I've planned my meals out. I've done more shakes and protein shakes, softer foods, because it really does matter. If you eat something hard, you may pull a stitch or a suture, and that could really make the whole procedure not take as well. It's not gonna get an optimal result. Eating habits are important. So number 5 is mouth care, or how do you take care of this after you've had your procedure. So we'll start with the one side, single implant or 2 implants, one side, bone graft. So for the first 24 hours, you're really gonna do very little to nothing besides ice your face. I think we talked about that before. The second part is how do you clean this area? So in our office, we're gonna provide you with a really small, soft brush. It's called a Nimbus, super soft bristles. My mentor says it puts the passion back in brushing. He uses it on a regular basis. I use it for post-op because you can really it's got a small head, so you can get it around the teeth that are not affected. It doesn't pull sutures because the bristles are super soft. And it's important that you clean these teeth. Now you can wait 24 hours before you do it, because what happens is plaque builds up, and some of the food that you really tried to eat on this side, but it got over here, gets around that area, caught in the stitches, and it starts to really give you some discomfort. So that's the part of cleaning it. There's also rinsing. Got to be careful with rinsing. We will give you either a specific rinse here, or we will give you a recipe for salt water rinse. Now, what's important to know about rinsing is you don't do it for 24 hours, and you really have to do it lightly, kind of like, I know that looks ridiculous, but you kind of have to shake it around in your mouth. You can't swish vigorously, because again, you might pull a stitch out, or you might pull, if there's what's called a barrier or a membrane, you might pull that out, and then the whole procedure can go downhill. So rinsing. There's also one thing that we administer, which it's an antioxidant gel that you just kind of apply over the site, let it soak in, and it really does a good job of cleaning the area. It freshens your breath. So these are some of the things that you really need to be doing after the procedure, and you got to do it until it's healed. If you have a full row of teeth, one-shot smile, that's a different beast all again. So we talked about the soft diet, but for taking care of it, the best thing is lightly rinsing with salt water, or one of the rinses that we give you, and maybe going with a water pick at a slower speed that goes along with following the instructions that we give you. But I can't emphasize again how important it is for me to make sure that I was rinsing the area, cleaning, otherwise pain does come. It goes away as soon as you do the follow-up rinses and the gels. So make sure you take all these pieces of advice and all these instructions and use them. So again, these are 5 things that are really important to manage your emotions, your anxiety before the procedure, and your comfort and lack of pain after the procedure. It's important for you. It's important for me, like we talked about. This is Dr. J. today, and I hope you all have a phenomenal day.